Hi everyone, welcome to Huntington Beach Senior Center. It's so great to have in-person events again, so thank you all for joining me this afternoon. My name is Audris Tien. I'm a doctor of podiatric medicine. All right, a little bit about myself. I was born and raised in Southern California. I received my undergraduate training at the University of California, San Diego, where I majored in biochemistry and a minor in psychology. I pursued my doctorate at the Des Moines University in Des Moines, Iowa. And I came back here to do my residency locally at Chino Valley Medical Center. I currently practice with Orange County Podiatry. We have 4 locations throughout Orange County to serve the community, and we are obviously affiliated with Hoag today, so thank you, Hoag, for putting this on this afternoon. Out of curiosity, how many of you have ever seen a podiatrist before, maybe? Okay, several of you, wonderful. Well, for those of you who don't know what podiatry is or what we do, hopefully this talk will provide some education on how we can help you with your foot and ankle care. I don't have any financial disclosures, but I do want to say that this talk is not meant to be medical advice, so if you do have any questions or concerns about your feet, I do suggest you talk to your healthcare professional. And so today I will give you some bad news when it comes to aging feet and ankles, but hopefully provide you some good news as well. We'll talk a little bit about common conditions that arise in our feet and ankles as we age, and I'll hopefully provide you some useful tips and tricks that you can apply in your daily life to take your feet from this to this. So this is an overview of some of the things we'll discuss today, some common problems associated with aging feet, decreased circulation or blood flow to your feet. You may suffer from wear and tear arthritis, also known as osteoarthritis. You may experience different types of foot deformities such as bunions or hammer toes to your feet. You may notice some skin and nail changes as we age. The quality of our bone can also decrease as well. And the other medical conditions such as diabetes or high cholesterol, whether these are new onset diagnoses or progressively worsening chronic conditions, can also manifest in our feet and ankles. When it comes to circulation for the feet, there are 2 main pulses that we look for. The first is called the dorsalis pedis pulse, which is located on the top of your foot. The posterior tibial pulse is also the second pulse located on the inside of your ankle. Your doctor might also perform something called the capillary refill test, which is where they press on your toes and look for how long it takes to pink back up. If your doctor cannot feel any of your pulses or is concerned about your circulation, he or she may refer you to a vascular specialist or to obtain some non-invasive vascular ultrasound studies. The condition known for decreased circulation is called peripheral arterial disease or peripheral vascular disease. This is basically narrowing of the arteries that results in reduced blood circulation to your feet. A great analogy I like to use for this is thinking of your arterial circulation as a plumbing system. The pipes get smaller and smaller as they go down from your heart to your toes, and any type of clogged pipe can reduce reduced flow of water through the pipes. So this is similar to where you get reduced blood flow down to your feet. Some common signs of poor circulation may include loss of hair on the feet or legs. You might experience numbness or weakness in your lower extremities, although there are other contributing causes to this as well. Your skin might be thinner and shinier. You might have poor capillary refill to the toes. Your skin might be dry, and you may experience leg pain or cramping that may stop you from participating in activities. At the more progression of the peripheral vascular disease, you might have rest pain at night, even though you're not doing anything, you're just laying down in bed. You might subjectively feel cold legs or feet. And at the end stage, you might see color changes to the skin, such as it turning red, purple, blue, or black. And this is something you want to report immediately to your healthcare provider. Some common risk factors for PAD include smoking. This causes constriction of the arteries and reduced blood flow. Obesity, diabetes, high cholesterol, high blood pressure, and heart disease are also higher risk for PAD. Any type of sclerotic or high cholesterol plaques can cause a thickening in the lumen of your arteries or the walls of the arteries and cause them to harden and have reduced blood flow through them. Any history of stroke and obviously advanced age can also increase your risk for PAD. So the feet and ankle are pretty complex parts of your body. I don't know if you know, but the foot has 26 bones, 30 joints and over 100 muscles, tendons, and ligaments, all of which work to support the feet and provide mobility. So arthritis can develop in any joint. With increasing age, it's typically associated with wear and tear of the body. This is known as osteoarthritis and is different from rheumatoid arthritis or psoriatic arthritis, which are typically autoimmune types of conditions. We will not discuss that today, but osteoarthritis can progress with age. You might notice your joints becoming stiffer, less flexible. The fluid lubricating the joint can decrease and result in wear and tear of the cartilage and result on end bone rubbing and causing pain. In the lower extremity, this commonly affects the ankle or the big toe joint and can result in deformities that make walking more difficult or painful. And this can result in deformities that then manifest as corns and calluses that you notice. And pictured here is a common area of the big toe joint that gets arthritis. You can get bone spurs that you may see visibly on the top of your big toe joint. And radiographically, this is what we see on x-ray findings typically. Foot deformities you may notice as we age are increasingly progressive bunion deformities. This is when your big toe joint or your big toe starts moving laterally over towards the second toe, and you might notice these painful bumps on the inside of your foot. Hammer toes are basically a curling of the digits due to a muscular imbalance in which your toes start to contract. These can also become more rigid over time and result in painful corns and calluses as you continue walking on them. And if you're so lucky, you get this combined deformity of bunions and hammer toes where the big toe starts underwriting the second toe, which also overlaps. And these can become more painful and more difficult to treat conservatively. You can also get foot deformities involving your hind foot or your ankle. Here you can see a progressively worsening flat foot deformity. Over time, as we age, the tendons and ligaments that hold up our arch can get stretched out, resulting in reduced arch height and causing an increase in the length or width of your feet. When these ligaments and tendons kind of get stretched out and are not supporting the feet as they should, you're also more likely to develop muscle strains, tendinitis, tendon tears, and pain in your feet. Other skin changes you might notice as we age are dry skin. So it's pretty normal for skin to become thinner, lose its elasticity, and be shinier as we age. Going barefoot or wearing open-toe shoes or open-heeled shoes can also make the skin dry out faster because the moisture is evaporating more quickly. So wearing closed-toe shoes and socks can help prevent this. When it comes to the fat pad, you can lose some of your fat pad. The common places for you to lose it are in the areas of the ball of your foot, right here, as well as on the bottom of your foot on the heel bone. And this can result in less cushioning and shock absorption for your feet, so you might have more pain when walking. Corns are basically thickening of the skin, typically located on the top of your foot, typically in the area of the toes. This is often a result of either toe deformities or bony prominences combined with poor or ill-fitting shoe wear that is too tight or narrow, and this can be very painful when walking if left untreated. And callus formation is typically located on the bottom of your foot, and these develop in response to shearing or friction forces as we walk. And in this particular patient, the anatomy of the callus really tells us a lot about how this person walks and where they put pressure. So because they have this bunion deformity here, this patient puts more pressure on the inside of the foot, and as they roll forward, their foot kind of rolls inward, developing the shearing calluses here and here. And because that big toe joint is not bearing as much weight as it should due to the altered biomechanics of the bunion deformity, it causes transfer pressure onto the lateral aspect of your foot, causing these calluses here and here. So hyperpigmentation, the skin discoloration is caused by the hemosiderin staining of the skin. This is typically seen as a byproduct of a result of the breakdown of hemoglobin, and this occurs when red blood cells leak out through veins, causing this brownish pigmentation to the skin that we can see on both your shins here. You might notice changes to your nail, including it becoming more yellowed, thickened, or crumbly. With age too, the nails become more, they grow out even slower. They already take about 9 to 12 months to grow out completely, but they might even grow out slower as we age. The nail shape can also become more rounded, causing or predisposing you to ingrown toenails, combined with poor fitting shoe wear. Fungal infections are the leading cause of nail disorders in the elderly. However, there are other chronic conditions such as diabetes, poor circulation, or nutritional deficiencies that can also play a role with thickened, brittle nails. Lower extremity swelling. There are a variety of reasons for lower extremity swelling, ranging from more serious conditions to more benign conditions. Serious causes of lower extremity swelling include congestive heart failure or a blood clot known as a deep vein thrombosis. But the most common cause typically is something known as chronic venous insufficiency. So normally, veins help reduce or bring blood back to your heart, and there are valves here that help ensure this one directional blood flow. But sometimes with chronic venous insufficiency, as we age, these valves no longer work as they should and become diseased and faulty, allowing blood to flow in both directions, or sometimes just causing pooling of the blood here. And this can result in kind of that heavy, tired, aching legs due to swelling in the lower extremities. And sometimes, if left untreated, can develop painful varicose veins, venous leg ulcers, or even recurrent bouts of skin infections. As we age, we also lose the bone mass and density to our bones, especially for women after menopause. This can result, you also lose calcium and other mineral deposits to your bones, and this can result into stress fractures or other pathological fragility fractures due to decreased bone strength. So a simple fall may turn into something much more with poor bone quality. So other age-related health problems that may manifest in the feet are diabetes, especially in the presence of neuropathy or loss of sensation to your feet. Gout can also present in the feet, typically in the big toe joint. Obesity and high blood pressure can also create more pain while you're walking due to more pressure on your feet. And decreased ability to heal. So if you have any wounds or cuts, it might be more difficult for you to heal those. So now we kind of get to the good part, or the good news about some things that you can do to help prevent some of these common problems associated with aging feet. Exercise is probably the best way to prevent these problems and help with maintaining stability, strength, and flexibility. I recommend about 30 minutes a day of aerobic exercise 5 days a week if possible. Please use any assistive devices you feel that you need to maintain good balance, and talk to your healthcare provider before starting any type of new exercise program. But that is very helpful for maintaining the muscle mass and bone density. When it comes to footwear, I recommend getting your feet sized every time before you buy new shoes. And it's best time to do this first thing in the morning before your feet start getting a little bit of swollen. You want to pick shoes that are wide enough and extra depth enough to accommodate any type of toe deformities you might have. And self-care is really important, so this includes regularly washing your feet, drying well in between the toes especially, followed by moisturizing with a foot cream. And so when it comes to foot deformities, what are some things you can do about this? Non-surgical management includes modification of your footwear, so finding shoes that are comfortable for you, whether this means modifying the shoe specifically to allow for that bunion deformity, for example, or just finding something that's extra wide. Padding, there's various types of padding options that can be helpful for preventing pain from toe deformities. Custom orthotics might be a great option for offloading any bony prominences on the bottom of your feet. And injections can be helpful for soothing any types of pain associated with these, but they probably will not take your foot deformity away. You can talk with your foot and ankle surgeon about any surgical considerations for your specific foot deformities and to see if this is a good option for you. So here are some pictures of various types of padding and strapping options that are available on the internet, on Amazon especially. That's where I refer a lot of my patients to, because it seems to be the easiest to get these products in your hands. But I will go through a couple of these so that you know what to look for. These bottom two down here, we call those Crest Pads. Those are great for hammer toes, so it helps with the alignment of the toe and kind of straightening them out as you wear them. The strap specifically in tops is made of like elastic material that helps provide some pressure to kind of reduce the toe deformity itself. This is a gel toe separator that can be great for creating space in between the toes, because sometimes interdigital corns are a common problem that can be painful. If you can create some space in between them, then you won't have the pain there from it rubbing. This is an example of a bunion splint that won't take your bunion away, but it will help kind of maintain the flexibility of the joint and put it in a better alignment. And this is an example of some gel toe sleeve that's helpful to prevent some skin irritation on the toes. So what can you do about certain skin problems? I do recommend a daily foot exam. This involves visually inspecting the tops and bottoms of your feet once a day to look for any cuts, scrapes, or wounds, blisters, calluses, things like that that can become a source of pain or infection for you. If you are unable to see the bottom of your feet, I do recommend a telescoping mirror similar to this that allows you to see the bottom of your feet, or please ask a friend, neighbor, or loved one to look periodically for you. Moisturizing your feet is very important after you've showered to help trap the moisture in. I do recommend a foot cream as opposed to a lotion, which is different. Lotions are typically have a higher water content and evaporate more quickly, while foot creams are typically more oil-based, able to penetrate deeper and last longer. Foot creams typically come in like a twist top or a jar, as opposed to lotions which come in a pump style. You want to make sure your shoes fit properly. And to avoid any types of pinching calluses or things like that. And if you do have any corns and calluses that are painful for you, these can be trimmed down by your friendly local podiatrist. And there are topical corn removers out there on the market that can be used sometimes for self-maintenance. However, I recommend avoiding these if you are a diabetic, as they can cause more problems than good. Sometimes different padding and cushioning options are also helpful for reducing the severity of the corns and in between your office visits. And so prevention really is key when it comes to these skin changes. This does involve a level of self-maintenance and self-care though. So these are there are a variety of offloading pads available as well for offloading calluses. These are 1/4-inch style felt pads that help to offload painful calluses or bony prominences on the bottom of their foot. They can be adhered directly onto the bottom of the foot or on the top of the toe, for example, to reduce pressure over these bony prominences. Sometimes a custom foam accommodative orthotic like this can be helpful for providing additional cushioning and offloading the bottom of the foot. So what can you do for certain toenail problems? You want to make sure that your toenails are well trimmed to prevent pain and infection. If you do suffer from toenail fungus, there are some prescription and over-the-counter topical antifungals you can use. But for most people, just kind of maintaining them so that they're easy to trim is probably the goal here. So Vicks Vapor Rub or tea tree oil has natural antifungal properties, which can help to soften the nail and reduce the fungal load. Vinegar soaks are another great option for treating this. Just once a day, soak for about 15-20 minutes, about 2 parts water, 1 part vinegar to help reduce the fungal load. Making sure you have proper footwear so that they don't cause curved type nails that can predispose you to ingrown toenails. You want to change your shoes and socks frequently. Fungus likes dark, moist areas, so if you suffer from foot sweating or hyperhidrosis easily, you'll want to change your shoes and socks more frequently. And if you have any concerns about trimming your own toenails or maintaining your own level of routine foot care, please do see your foot and ankle specialist. So when it comes to arthritis, if you suffer from this, what are some things you can do to help prevent pain? Probably the easiest thing will be to modify your activities. Any type of high impact activity can make the pain worse. There are great different forms of alternate exercise, such as swimming, bicycle, or elliptical that can be great alternate exercises. You do want to make sure you are in the proper shoes for any type of activities that you are engaging in. Custom orthotics, as seen above here, or foot and ankle braces down here can be customly designed as well to accommodate some of the more severe arthritic joints. And if you do have any severe deformities that you want to have a consultation for, please go see your doctor as well. And so just a great way to kind of remind everyone to check in. I utilize the hashtag Self-Care Sunday. This is a great way to check in and remind yourself to see if your nails are well trimmed or if you're worried about an ingrown toenail or an infection. A reminder to kind of keep your feet well groomed and apply moisturizing cream afterwards. A foot massage can be great to promote circulation and just because it feels good too. This is also a reminder to make sure you've done your exercise for the week and to make sure that your footwear is in good condition and is properly fitting. So when it comes to footwear and shoes, a lot of people are always looking for recommendations regarding these. Some characteristics to look for in a good adaptive type of shoe is something that has a non-slip or non-skid sole to help prevent falls. You want something that has an easy open and close fastener. This is typically like a Velcro strap or a slip-on style shoe. You want to look for shoes that have a wider opening so it's easier to get your feet into shoes. You want to look for something that has additional padding on the bottom that provides additional comfort. And you want to consider the material of the shoes. So for example, a leather shoe might be more longer lasting and durable. However, the fabric is often more rigid and less forgiving to certain kind of deformities compared to a fabric-based shoe, which may be softer, more comfortable for you for anyone with foot deformities. However, they may not be as long lasting. And these are just a few brands that do offer some of the adaptive type of shoe wear that I'm talking about. I'll just show you a few examples of certain types of shoes for men and women's and highlight a few characteristics of things to look for in a good shoe. So you can see here that these kind of toe boxes extra depth, meaning that they can accommodate top to bottom, different kind of toe deformities and bunions. This is a more leather material, but it has Velcro straps for ease of putting on. This type of shoe has a fabric top, which might be more forgiving for something like hammer toes in this example. And this kind of sandal has some great supportive straps across the top and the back as an option for someone who doesn't always want to be in enclosed shoes. Some examples of women's shoes, but basically the same types of things we're looking for. Something extra depth, can be extra wide side to side as well. We have the Velcro straps here and the closed toe, closed back heel. Sometimes putting on shoes is half the battle. So they do make some extra long shoe horns that can be very helpful to make your shoes more accessible and easier to put on so that you don't have to lean over or crouch all the way down to put your shoes on. And there's even something called a sock aid to help put on shoes because I know there's a lot of seniors who have difficulty putting their own socks on. So there's these types of adaptive devices are available in the internet or at your local DME store. And so this is just another reminder for ways to take care of your feet at home. Remind yourself to do a warm water foot soak, about 15 or 20 minutes. Pat it dry well, especially in between the toes that like to trap moisture there. Feel free to put any kind of massaging lotion or oils afterwards, and then to do any type of routine foot care for your nails or corns and calluses if you feel comfortable. And so when should you go see your local podiatrist? If you have any type of foot and ankle pain and want to have this evaluated further, highly recommend you to do that. If you suffer from any types of foot or ankle deformities that need a consultation, whether it's surgical or non-surgical treatment, it's great to get that evaluated at least once. If you are concerned about any type of foot infection, you want to go in sooner rather than later. For any diabetics out there, I highly recommend at least an annual diabetic foot exam, if not more often than that, to catch any problems before they start. If you have any nail changes or painful calluses and corns that you cannot maintain on your own, I recommend you to see your podiatrist as well. A few tips for diabetics out there to prevent diabetic foot complications. The first is avoid barefoot walking. This includes inside your own home. Diabetics are higher risk for ulcerations, infections that can lead to serious illness, hospitalizations, and loss of limb. So please wear closed-toe shoes and socks at all times. Inspecting your feet daily, so looking for any cuts, scrapes, or wounds, blisters, anything draining like that. And then please use a mirror or ask a friend if you cannot see the bottom of your feet. I recommend obtaining professional foot care to do your corns, calluses, and nails. Please stay away from over-the-counter corn removing products as this can damage your skin and cause wounds. Wearing comfortable shoes and socks. So you want something that's extra depth and extra wide, which is your typical diabetic shoe. And please ask your healthcare provider if you qualify for such things. And please utilize podiatrists as part of your healthcare team and obtain an annual diabetic foot exam. At the very minimum, your podiatrist may recommend you to be seen more frequently than that, but this is really vital in preventing wounds and infections and that kind of thing. And so that's all I have for you this afternoon. So just a quick reminder to love your feet too. And at this time, I guess I'll take any questions if there's any from the audience about anything. Yes? Sure. So heel pain is a plantar fasciitis. Typically, you feel it kind of first thing in the morning when you wake up or after any prolonged sitting and you go to get up again. You have heel pain in your feet. It's the most common cause of heel pain typically. It's basically associated with the thick ligament called the plantar fascia, which is on the bottom of your heel, closely connected to the Achilles tendon, which also inserts onto the heel bone. It's typically an overused degenerative type of condition, which makes the plantar fascia more thickened and can make it very painful to walk. I guess without giving my whole spiel for it, I usually kind of break it down to 3 treatment categories. So soothe, stretch, and support. There's unfortunately no one magical thing that takes the pain away. It's really a combination of everything and time. And I do really harp on the stretching and the good support for this condition. Yeah. So our Huntington Beach office is actually not too far away on 18800 Main Street. Right across from, there's a Quest Lab in that building. It's across from the Hoag Health Center, near in that area. But I can provide my address for you if you'd like. But we also have offices in Orange, Irvine, and Newport as well. Yes?
If you're sitting up like this at the end of the day and your feet start tingling, what is that usually from?
Hard to say for sure. It could be kind of that circulation coming back where you kind of feel the blood flow return back to your feet. It could be signs of neuropathy or kind of your nerves firing in relation to diabetes or other causes of neuropathy. If you have any low back pain or kind of shooting sensation going up the leg, that might be more related to the nerves or pinched nerve in your back as opposed to something isolated in your feet. Because the socks are providing some level of compression. So I bet if you wore like higher knee-high socks or something like that, you notice the swelling would kind of end at your knee in that case. But yeah, the lower extremity is a common place simply because of gravity. You know, we are spending a lot of time upright, causing it to kind of pool down there. Knee-high, perfect. All right, well, thank you so much for everyone spending your afternoon with me today, and I hope you guys have learned something. Feel free to reach out if you have any questions or concerns regarding your feet, okay? Thank you.